So your today's class is on hypothyroidism. It's basically theoretical class more, but practical knowledge you must be having, है ना. कोई भी short note आ सकता है आप लोगों के hypothyroidism के ऊपर, ठीक है. कई diseases होती हैं उनके DD के अंदर hypothyroidism रखा जाता है. So you must be aware about hypothyroidism. What are the clinical features? When you will suspect a case of hypothyroidism, what are the investigations you have to order if you are suspecting case of hypothyroidism, and what is the treatment for hypothyroidism, and how it is important in view of newborn screening. Can anybody tell what newborn screening we are doing to rule out hypothyroidism? Anybody knows? जब बच्चा न्यूनेटल पीरियड में होता है तो हम वी आर डूइंग सम स्क्रीनिंग टू रूल आउट सर्टेन डिजीजेस. सो थायराइड इज वेरी इंपॉर्टेंट इन दैट पीरियड. व्हाई इट इज इंपॉर्टेंट? बिकॉज इट इज द मोस्ट कॉमन कॉज विच इज ट्रीटेबल फॉर डूइंग मेंटल रिटार्डेशन. इट इज द ट्रीटेबल कॉज ऑफ मेंटल रिटार्डेशन. If you will give the treatment within first 2 weeks of life, then child will be absolutely normal. So it's so much important. That's why emphasis has been given that in neonatal period you must do the thyroid screening, which is TSH we are doing. So we will start about hypothyroidism. So first about the thyroid gland. It is very important how it's going in the fetal development. So thyroid hormone are needed in fetal life for development of fetal neuron and the brain. The maternal thyroid hormone crosses the placenta and provides the thyroid hormone required for the brain development of fetus. Thyroid gland develops early in the fetal life. In fetus, TSH is secreted in first trimester of fetal life, while thyroxine secretion starts in the second trimester. So from second trimester, the fetal thyroid gland starts secreting TSH. But till the second trimester, who takes the role? It's the maternal thyroid hormone which takes the role. So how thyroid function in the fetus? Fetal thyroid begins to make the TSH about 10 to 12 weeks, means first trimester of life, which appreciate thyroid hormone by about 18 to 20 weeks, means it's the second trimester. So fetus is heavily reliant on maternal thyroid hormone, especially in the first trimester. Okay? Maternal TSH doesn't crosses the placenta, while thyroid hormone and thyroid releasing antibodies can cross. Now for the physiology. Thyroid hormone. Thyroid hormone are secreted in response with the stimulation by the TSH. TSH कहाँ से secrete होता है? From the pituitary gland. ठीक है. So it's the hypothalamic pituitary axis is there. Pituitary is secreting majority of many hormones. ठीक है. So two forms of thyroid hormone is there, T3 and T4. So the two forms are T3 and T4. T3 is basically active form, which is triiodothyronine, and T4 is thyroxine. ठीक है. T3 and T4 present in the blood circulation exerts a negative feedback on the secretion of TSH. So जब T3 और T4 हाई होता है तो TSH कम हो जाता है. तो हाइपोथायराइडिज्म में क्या होगा? जब T3 T4 कम होगा तो TSH ज्यादा होगा. ठीक है. So is the axis hypothalamic pituitary thyroid axis. Hypothalamus से secrete होता है thyrotropin releasing hormone TRH. ठीक है. Which acts on the pituitary gland to secrete the TSH. ठीक है. TSH then acts on the thyroid gland which ultimately secretes T3 and T4. ठीक है. In an average adult person, thyroid gland produces 6 microgram of T3 and T4 is 100 microgram. This T4 which is secreted is basically inactive form. ठीक है. When it's going to be action in various organs, it is again converted into active form T3 by deiodinations. ठीक है? So synthesis, thyroid gland produces daily T4 of 100 microgram and T3 of 20 micrograms. Most of thyroid hormones in the blood is T4. Enzyme in the liver, kidney and other tissues convert T4 into T3. T3 is physiologically more active form. And most important, iodine is required for synthesis of thyroid hormone. Now what is the physiological effects of thyroid hormone? In the growth, thyroid is necessary for the normal somatic growth, means increase in the height of a child. Development wise, thyroid hormone is required from brain maturations, development and the functions. Metabolism, thyroid hormone stimulates the metabolic activities, increase the BMR. How it increases the BMR? Carbohydrate metabolism it increases, glucogenolysis, gluconeogenesis and entry of glucose in the cells. So basically metabolism it increases for all three: carbohydrate, fat and protein. Lipid, fat mobilization and oxidation of fatty acids, and protein increase its catabolism. Systemic effects, thyroid hormone is responsible for increasing heart rate and cardiac output. तो जब hypothyroidism होगा तो cardiac output कम हो जाएगा, heart rate decrease हो जाएगी. Hyperthyroidism होगा तो heart rate increase हो जाएगी, cardiac output बढ़ जाएगा. CNS में its increases promote mental activity. That's why hypothyroidism child is suffering from mental retardation, because mental growth के लिए जरूरी है. GIT it increases the motility. So जब hypothyroidism होगा तो motility decrease हो जाएगी. तो decrease motility तो patient will be complaining of constipation. ठीक है? In reverse, if hyperthyroidism, then you will get diarrhea. Now, as thyroid hormone is secreted from the thyroid gland, ठीक है? So you must be aware कि if enlargement of thyroid is there, that is known as goiter. ठीक है? So low level of T3 and T4 in the body increases TSH secretions, which stimulate the thyroid gland, ultimately leads to goiter. ठीक है? Iodine deficiency is important. You can consider thyroid gland as a factory. ठीक है? फैक्ट्री के अंदर रॉ मटेरियल ही नहीं है तो कितना स्टिमुलेशन दे लो, हाइपोथायराइडिज्म परसिस्ट करेगा. सो आयोडीन इज बेसिकली रॉ मटेरियल. ठीक है? इन केस ऑफ आयोडीन डेफिशिएंसी you will get endomic goiter. In case of congenital agenesis, when there is thyroid gland is not properly formed, at that time you will get T3, T4 will be low, but goiter will not be present because thyroid gland is not properly formed. So despite of low T3, T4 and high TSH, you will not get the goiter. Now we will go on the iodine deficiency disorders. So how the role of iodine is very important in hypothyroidism. Iodine is essential for synthesis of thyroid hormone. Daily requirement of iodine is 100 microgram per day. Iodine deficiency causes enlargement of thyroid and endemic goiter. Iodine deficiency impairs the brain development as it is a part of thyroid hormone and which is very much essential for brain development. Iodine deficiency is common in hilly areas. ठीक है? ये सब पढ़ते आ रहे हैं, फिजियोलॉजी में पढ़ाया जाता है ना? Because of hilly areas, you will getting iodine deficiencies common. Now, effect iodine deficiencies result into goiter and hypothyroidism. Iodine deficiencies, some epidemiology. It is very common in 130 countries. 740 million people are affected. 13% population affected, 30% at risk, and 50 million brain damages. So it's a very, very important risk factor for development of mental retardation and largely affecting, especially in hilly areas. Now, iodine deficiency disorders, if mother is deficient with iron, how it can affect the fetus? It can cause abortion or stillbirth, deaf mute with severe neurological damage, and cretinism. What is cretinism? It's congenital hypothyroidism. Childhood, if the child is not having iodine, then simple goiter might be child having, or low intellectual functions, mental retardation, or hypothyroidism. Now causes of the goiter in children, iodine deficiency, as we have already read, child may have hypothyroidism. Second cause of this goiter may be dysharmonogenesis. ठीक है, dysharmonogenesis when there is an enzyme deficiency which is required for thyroxine hormone production. ठीक है, this also may leads to hypothyroidism. Silence. कौन बातें कर रहा है? किसी को नहीं पढ़ना है आराम से अटेंडेंस देके जा सकते हैं. ठीक है, यहाँ बैठने की किसी को कोई जरूरत नहीं है. ठीक है, किसी को बैठना है, पढ़ना है, सुनना है तो अच्छी बात है, नहीं बैठना है आराम से अटेंडेंस दे जाओ. ठीक है, फाइनल ईयर है, इसके बाद के अंदर कोई नहीं पूछने वाला तुमको. सब स्टैम्प्ड जो है आरएमपी बन जाओगे, रजिस्टर्ड मेडिकल प्रैक्टिशनर. और आगे कुछ करना है लाइफ के अंदर, कुछ करना है तो सुनो आराम से उसको. नेक्स्ट कॉमन कॉज ऑफ goiter is thyroiditis. Thyroiditis means any word with itis means inflammation. Thyroiditis, inflammation of thyroid glands. So autoimmune diseases used to be causing thyroiditis. It may also develop hypothyroidism. Initially the thyroiditis patients, they are having hyperthyroidism, but in later life they will goes into the hypothyroidism. Now we will come on the hypothyroidism. So hypothyroidism may be congenital or acquired. Congenital, as we have also known as cretinism. Hypothyroidism presents since birth. So its epidemiology, it is affecting usually 1:2000 births. Mostly it is caused by the agenesis of thyroid glands. Here we are not having most common cause as iodine deficiencies. Thyroid gland formation is affected. So agenesis of thyroid leads to hypothyroidism in a neonate by birth, causing cretinism. So cretinism may be presented in infancy or later in the child in diseases with partial thyroxine secretions, and it's a less severe diseases. Acquired hypothyroidism, which is present in the older children. Cretinism, now by case-based scenario, just understand how these cases are presenting to you. A 2 months baby presented in OPD with complaint of poor feeding, noisy breathing. Child is developed by vaginal delivery and was normal at birth. He remains constipated. ठीक है, history of constipation is there. Passes stool only when a suppository is given. On examination, child weight is 4 kg. His mouth is open, tongue is visible. Abdomen is distended with gases and umbilical hernia is present, and he has dry skin. So all these are features of hypothyroidism: dry skin, umbilical hernia, widely open mouth, ठीक है, constipations. All these are history of a hypothyroidism. So causes of congenital hypothyroidism, either thyroid dysgenesis. So as we have already discussed, most of the cases are because of thyroid gland dysgenesis. 90% of cases, absence or ectopic development of thyroid gland, which is most common. Second is iodine deficiencies, which is seen in mountain regions. Mother is having iodine deficiency and goiter. Third one is thyroid dysharmonogenesis. ठीक है, absence of an enzyme which is responsible for production of thyroxine in gland. Genetically it is autosomal recessive inheritance. Goiter may be present in newborn period or may be developed in later period. And last one, which is very rare, is TSH deficiencies. Now cretinism, then next one is childhood hypothyroidism or acquired hypothyroidism. Here also case in like a 6-year-old boy presented with complaint of delayed mental development. Child starts walking at 3 years of age and speaks only few words. He keeps sitting and is not active. He remains constipated since birth. On examination, weight is 15 kg, height is 95 cm, which is less. His face is puffy with depressed nasal bridge and a large visible tongue. He has dry skin and cold hand. He has a hoarse voice. ठीक है, all these are features of hypothyroidism. Delayed development, mental development, ठीक है, height is less, short stature, face puffy with large tongue, dry skin, cold clammy hands and hoarseness of voice. So causes of childhood hypothyroidism: congenital hypothyroidism, which will be diagnosed later. Maybe the problem is since the newborn period but not recognized, so you will recognize in the later period. So that congenital hypothyroidism causes already we have discussed. Second one, most common, iodine deficiency, which causing goiter. Thyroiditis, autoimmune disorders seen in older children and mainly in girls, and rare causes surgery or radiations. Now, how to recognize the hypothyroidism clinical features? Older children, you will get delayed development, short stature, poor activity, large tongue, thick lips, puffy face, hoarse voice, dry skin, distended abdomen and constipations, anemia, and last one is goiter. So all these are clinical features of hypothyroidism. Cretinine may be late presentation in case of congenital hypothyroidism. This is the face, typical face of hypothyroidism. Puffy face है, tongue protruded है, ठीक है, dry coarse faces है. These are later child which are presented, ठीक है, short stature, abdomen distended, umbilical hernia. Now how you will confirm hypothyroidism? Lab diagnosis. So lab diagnostic test, you will go with bone age. Bone age will be delayed. For bone age, you will go with X-ray knee in newborn period, X-ray wrist in children. For thyroid profile specific investigations, T3, T4 will be less, TSH will be high. Radioisotope scan for thyroid to detect thyroid tissues and anti-thyroid antibodies to rule out the autoimmune thyroiditis. So what are the complications of hypothyroidism? There will be delayed physical development, short stature, delayed mental development, mental and intellectually handicapped child. Now what is the treatment? Treatment is very simple. You have to give thyroxine replacement therapy. The diagnosis is difficult, but treatment is very simple. Only you have to give the thyroxine. So thyroxine, but it is very crucial. You must be started as soon as you will diagnose hypothyroidism. You have to start the thyroxine tablet. So treatment must be started within first 2 weeks of life to prevent the brain damage. Thyroxine tablets given orally, lifelong. ठीक है? Thyroxine tablets are given empty stomach, usually in morning, and daily dosage should not be missed. These are the crux for starting the thyroxine tablets. They must be given empty stomach, lifelong treatment. So this counseling also you have to be given to parents कि जब बच्चे को आपने hypothyroidism के लिए diagnose कर लिया and cause is like the gland is not properly formed in whole life, this thyroid gland is not going to be produced sufficient of thyroxine hormone, then you have to give the thyroxine lifelong. So dosage wise, in newborn period, the dosage requirement is more, 10 to 15 microgram per kg. In 6 to 12 months, 6 to 8 microgram per kg. Then from 1 to 6 years, 5 to 6 microgram, and 6 to 12 years, 4 to 5 microgram per kg. ठीक है, on an average 5 to 6 microgram you are giving. In adult there is fixed 100 to 150 microgram. ठीक है, it's not per kg, it's fixed 100 to 150 microgram. Now how you will monitor? Clinical monitoring, you will go with the growth charts. You will assess the linear growth of a child with weight gain, developmental progression and investigations. What investigation you will advise? The thyroid profile T3, T4, TSH every 3 to 6 months. Now how to prevent the hypothyroidism? So fetal life, as we have already discussed, spontaneous abortion will occur, congenital anomalies, endemic cretinism, neonatal period hypothyroidism, mental retardation and increased mortality. Childhood you will get goiter, hypothyroidism, neurocognition defects, impaired physical development and lower intelligence coefficient. So you may consider, like in fetal life with less complications, as the age is increasing you will get more and more complications. So for prevention of hypothyroidism, iodine deficiency, you have to give community education as well as iodine supplementations. अब जितना भी जो आपका salt आता है सब iodized salt आता है. ठीक है, it's the government policy, all salts are iodized except रॉक सॉल्ट. ठीक है, जो सेंधा नमक होता है ना उसके अंदर आयोडीन नहीं होता है. कंजेनाइटल हाइपोथायराइडिज्म रिक्वायर्ड अर्ली डायग्नोसिस एंड ट्रीटमेंट, न्यूबॉर्न पीरियड, TSH screening is very important program. TSH is assessed at the either at the birth or at 7 days of age. Acquired hypothyroidism, high index of suspicion for diagnosis and treatment. So early diagnosis and treatment is very crucial part for hypothyroidism, because treatment is very simple. You have to give only thyroxine tablet. ठीक है, और कुछ नहीं देना है. But diagnosis is crucial. You have to be early diagnose it and start as early as possible. So take home messages: hypothyroidism is most important preventable cause of mental and intellectual handicap. Iodine deficiency is a preventable cause of hypothyroidism. ठीक है, जहां पे ग्लैंड बनी ही नहीं है वहां आप कुछ नहीं कर सकते. बट इफ द कॉज ऑफ hypothyroidism is iodine deficiency, it's a preventable cause and you have to be given only the iodine to the child. Early diagnosis and treatment after birth is important for normal mental development. ठीक है, so this is all about your today's class on hypothyroidism.